This year will enter flu season as we continue battling COVID-19. The symptoms between these two viruses are quite similar, which is a cause for concern for many, including parents. We sat down with Dr. Rongkavilit, a pediatric infectious disease specialist with UCSF Fresno. He explained how two similar-looking viruses affect children and which symptoms parents should look out for to determine if it's the coronavirus or the flu.
I will take care of children and teenagers with any kind of infections. Can be bacteria, can be fungus, can be virus, and majority of my patients are those with serious infections. For example, over here is children with valley fever or coccidioides infection. I would see kids with tuberculosis. I would see babies who is at risk for HIV or syphilis or herpes. Fortunately, children with COVID tend to do better compared to adult or elderly. They usually don't have a lot of severe symptoms. Most of them are either mild or they might not have any symptoms at all. But even with that, they are capable of passing the virus to others. My concern is that the symptoms of the influenza and the symptom of COVID are quite similar. So it's very hard to tell if one person is sick with fever, headache, stuffy nose, cough, whether that is due to influenza or COVID or both. One thing to be learned, with this COVID pandemic is there are certain things that seem to be unique to COVID. One is the loss of taste. The other one is a loss of smell. That is something that we usually don't see with influenza or with any other virus infections. For pediatrics, we are seeing more gastrointestinal symptoms with COVID compared to flu. For example, diarrhea. Parents know their child best more than anybody else. So I think talking to their kids is very, very important. Wear your mask. The second W is wash your hands. And the last W is watch the distance, 6 feet.